Hello, my name is Joy Ajiboye. I will be performing the NG tube and that of the ostonomy. So I'll be starting with the NG tube. So the first thing I'm going to be doing is I'll check my PCP order to that of my patient care plan, which is okay. So the next thing is I'll gather my equipment. Here with me, I've gathered my equipment. I have my cup of water. I have my basin, my Mrs. basin. I have my towel I'll be putting on my patient chest. I have my water-based loop. I have my tongue depressor. I have my scissors and my tape. I have my safety pin. I have my alcohol prep I'll be using to wipe the patient nose if it's oily. And I have my NG tube here with me. And I also have my patient here with me. And I have my trash bag. So the first thing I'm going to be doing is I'll be going to my patient's room. Hello, my name is Joy Ajiboye. I'll be performing the NG tube. Is that okay by you? He said, okay. Okay, can you tell me your name and your date of birth? Which which he said it is okay with what I have on my book, with my documents. So I will perform hand hygiene and I will put on my glove. So, Mr. Smith, I will be inserting the NG tube down. I'll be inserting the NG tube down your nose to your stomach. It's a little bit uncomfortable. It's gonna make you gag. If you need me to stop, please you can just raise your hands up and let me know. Do you have any allergy or any latte allergy? Okay, you said no. So if my patient is an MPO, I will not give him water to swallow. So I will just ask him to swallow. So if he's not an MPO, I will give him water to swallow because it helps to go down the throat easily. So the next thing I'm going to be doing is I will raise the bed to a working height position. I will lower the side way down, and also I will provide privacy. So I will make sure my patient sits upright by raising the bed to a high floral position as far as my patient can tolerate the position. So once again, I will verify the order, which I verify the order once again, and I will tell my patient the purpose of what I'm about to give him. The purpose is for feedings, sanction, and to empty any obstruction. So now, the next thing is, here's my patient. I will ask him to cough. So when my patient cough, I will look with my tongue. The pressure um, is intact. He has an intact gagging, and the next thing is I will use my pen light. I'll be using my pen light. I will use my pen. I'll be using my pen light to look at his nose and make sure his skin is intact and no breakage or polos, and also to know if it is safe to insert the tube, which it is. So the next thing is I'll place the towel on my patient chest. I'll be using my chest as my patient. I'll place the towel on my patient chest in order for there not to be any stain. So the next thing is I will get the NG tube. Here with me I have the NG tube. I will remove it from the bag and put it on top of the bag in order for it not to get contaminated. So the next thing I'm going to be doing is I'll get my tape. I'll get my tape. I'll cut the I'll divide it into two, which I'll be putting on my patient nose. Put this aside. Um, get a smaller one. I'll be using it as the mark. Put this aside, and I will get 3 to 4 inches, which I'll be using with my safety pin to put on his gown. So so the next thing I'm going to be doing is I will measure from the tip of my patient nose. I will get my tube. I will measure from the tip of my patient nose to the yellow to the xiphoid process, which here we may have 45. So I will put lubricate on the tube, which I've done that. I put lubricate, which I've done that. So in order for it to go into my patient throat easily. So the next thing is I'm going to be doing is I'll get my patient. It's going to make sure that your patient bends his head forward. When you bend his head forward, you place the tube. I'll place the tube to my patient nose, and once I'll place the tube to my patient nose. Once it gets to the back, I'll give him water to swallow. Swallow, 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 swallow. Swallow, 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 swallow. We almost go there. You go as quickly as possible. So since I've gotten to the marker, I'll stop. I'll get the tape. Place it on my patient nose. Make sure your patient nose is not oily. And use one of the tape, since it's cut into two. Wrap it on the tube. Use the other one, wrap it to the opposite side of the tube. So when you wrap it the opposite side of the tube, you get the other tape. Where you mark it, you put it the 45, you put it there. So you're gonna be I'll be using the safety pin to hook it on my patient gown. I'll use the safety pin to hook it on my patient's gown. So this the blue is for hair, while this other one is for the sanction. So what I'm going to be doing is I will close it in order in like the reason why I'm closing it is when it sneeze, when my patient sneeze, it doesn't come out, or when it eats food, it doesn't like come out. So that was the essence of closing it. So the next thing I'm going to be doing is um I will also I will check the initial tube placement with an X-ray. This may be required by some facility policy in order to confirm the correct placement X-ray. Which in order to confirm the correct placement X-ray, which will be verified. So the next thing I'm going to be doing is I'll take off my gloves. Perform hand hygiene. Now I'll be doing the remover. So for the remover, I'll perform hand hygiene and put on the clean gloves. I'll take off now. I'll put on a clean glove. So the first thing you're going to do is you unhook the safety pin from the patient. which I've done that. Then you try to tell the patient what you're about to do. Tell the patient that you're about to pull out the NG tube. Please, you need to take a deep breath. If you feel uncomfortable, you can just raise your hands up, and you can just raise your hand up if you feel uncomfortable. So the first thing is I'm going to unwrap the tape from my patient nose and pull it as quickly as possible. So pull it as quickly as possible, which I've done that. So make sure that the tip of the tube is intact, and make a note of any drainage or any mucus, make a note of any drainage or any mucus or bleeding. Then the next thing is you put it in the trash, in the trash bag. So you take off your glove, perform hand hygiene. So right now, so I'm done with that. Right now, I will be doing the ostomy. So for the ostomy, I will verify for the ostomy, I will verify my PCP order to that of my patient care plan. So in doing that, here with me, I have my basin of water to clean the ostomy. I have my measuring guard. I have my waiver. I have my towel. I have my bag, the ostomy, clip, and scissors here with me. So now I'll be going to my patient's room. Hello, my name is Joy Ajiboye. I'll be performing the ostomy. Is that okay by you? She said is okay. So can you identify yourself by telling me your name and your date of birth? Okay, which indeed is okay with what I have on my record. So I'll perform hand hygiene and put on a clean glove. So I will raise the bed to a working height position. I will lower the side weight down, and also I will provide privacy. So make sure make sure you tell your patient what you are about to do. Anytime you want to perform anything, make sure you communicate with your patient. So I will check if my patient has a bag already. So I will take off the bag. I will take off the whole bag and use the water wave remover to clean the surface, so that it can be easy to put I'll clean the surface so that it can be easy to put so that it can be easy so that it can be easy for the bag to stick to the surface. So the best time to change the bag is before meal, because if you change after meal, they are likely to stew. So after changing the bag, take off your glove, perform hand hygiene, and put on a clean glove. So make sure you work as quickly as possible, because if it's been exposed, if exposed, the more likely they have stool. So make sure your patient always have make sure your patient has a mirror beside them when you're about to perform it. And if they don't want to look in the process of when putting the ostomy, that's okay, but always make sure that they have a mirror beside them. So the second check right now, we verify the order once again, which I've verified the order. Everything is okay. So um I will so we verify the order once again, which everything is okay. Identify the patient. Can you tell me your name and your date of birth? Which he did is okay with what I have on my file. So the next thing I'm going to be doing is I will measure the ostomy. So in measuring the ostomy, You get your here is my ostomy. I will measure the ostomy. I will leave 8 to 6 inches wider, so that the bag do not touch the stomach, in order for it not to in order for there not to be a breakdown. Also, I will make sure that it is not too large or too small. So what I got here is one is half an inch, which is perfect. So which is what I'm going to be using. So the next thing I'm going to be doing is I'll take off my glove, perform hand hygiene, and put on a clean glove. So in putting on a clean glove, I'll get the waiver. Here with me I have the waiver with the scissors. I'll be cutting half an inch, and make sure you use your hand to smoothen the surface. So you put it with the bag. Take this off, and in the process of doing that, make sure that the bag is away from any wound or any IV. If your patient has any wound, make sure the bag is away from it. So which the bag is away from any IV or any wound. You take off the sealed one. Make sure it's sealed properly, and use the warm of your hand to seal it also. So the next thing is you get your clip to clip it. This clip can be reused. So in process of clipping it, which the clip can be reused. So make sure the stomach looks healthy, pink, and red. So you take off your glove, perform hand hygiene. You lower the bed, you raise the side way up, and uncover the privacy. So you document the dates, and you lower the bed, raise the side way up, and you put a cowbell at the reach of your patient, and you document the date, the time, assessment, procedure, and the patient response to the procedure. Thank you.